Hello, and thank you for joining us for today's hybrid education program at Cancer Support Community South Bay. I'm Rebecca, the program manager, and I welcome you to this workshop titled Combating Fatigue in Oncology. Before we begin, if this is your first time joining us, Cancer Support Community South Bay's mission is to uplift and strengthen people impacted by cancer by providing support, fostering compassionate communities, and breaking down barriers to care. Our vision is that everyone impacted by cancer receives the support they want and need throughout their experience. We serve the South Bay, Long Beach, and Orange County area all at no cost. Our program includes support groups, networking groups, healthy lifestyle classes, social activities, and educational programs like this workshop. Educational programs are open to all. If you'd like to hear more about our services or join a community, please visit our website at cscsouthbay.org. Before I introduce today's speaker, we ask you to keep your microphone muted to eliminate any distracting background noise. Please feel free to enter any questions into the chat function found at the bottom of the Zoom window anytime. And for those in person, we will be calling everybody at the end of the lecture. Without further ado, I'll introduce our workshop speaker. Colleen Malinow is an oncology certified nurse practitioner at UCLA with 12 years of oncology experience. She enjoys incorporating non-pharmaceutical modalities into her oncology practice to optimize patient outcomes. Thank you so much, Colleen, for being here with us today.
Thank you. Thanks, Rebecca, for the nice introduction. My name is Colleen Malinow. Again, I'm a nurse practitioner at UCLA Health, and I've worked in oncology for the past 15 years. I've worked inpatient, outpatient, and I currently work in hematological lymphoma, myeloma, and we're going to talk today about combating fatigue in oncology. So cancer-related fatigue, or as it's abbreviated, CRF, is different from normal low energy in that it's a constant depletion of your energy stores. Unfortunately, fatigue is the #1 side effect of any cancer-related therapy. And so unfortunately, a lot of times we just think it's part of the cancer. It's part of the cancer therapy, but there are a lot of modifications that we can do in our everyday lifestyles to help lessen the levels of fatigue. So first, let's start out by talking about what is fatigue. So from a medical standpoint, fatigue, sorry. Click out here so I can see the screen. Fatigue is sourced by metabolic demands. Cancer cells consume significant energy and nutrients, potentially leaving the body with less available for normal function. Cytokine release, that's kind of a generalized inflammation. A lot of times if you have things like an allergic reaction, you notice your body is inflamed and it uses those metabolic stores, causing fatigue. Cachexia, that unfortunately is a wasting syndrome that leads to muscle and weight loss. A lot of times that can be a result of being sedentary, whether it's being in the hospital or just more of a sedentary lifestyle during undergoing cancer therapies. Anemia is a big cause of fatigue in cancer patients. We have a depiction here showing red blood cells are what circulate throughout your blood, and they actually help to circulate oxygen throughout your body. So when your red blood cell stores are low for whatever reason, your body's having to work so much harder to circulate oxygen. Your body's having to work harder, it gets fatigued quicker. Hormone imbalances, especially for treatments for breast cancer and prostate cancer, any hormone shifts can lead to fatigue and organ dysfunction when the body processes food, or it causes organ problems that can lead to fatigue. So what type of oncology treatments cause fatigue? Chemotherapy, of course, is the big one. Unfortunately, it takes out the good with the bad and can weaken the body's ability to fight infections, and fatigue may be one of the first signs of infection. Immunotherapy, even though it's more targeted, it still can cause some cytopenias with anemia and such, and also it can lead to inflammation, which again can cause fatigue. Surgery can lead to fatigue as the body recovers from procedures. Radiation therapy, a lot of patients are really surprised that radiation can cause such fatigue. A lot of this is related to the tissues having to rebuild, also can be related to dehydration. And then hormone therapy, again, can disrupt hormone levels, which can also lead to fatigue. So today we're really going to focus on the modifiable causes of fatigue. The main ones with cancer therapy are pain, emotional distress, sleep problems, poor nutrition, and inactivity. So let's start off with discussing maintaining a balanced diet. The big take home to do throughout cancer therapy is try to eat small, frequent meals. 5 small meals a day is a good platform to go off of, but it's really important for your body to have regular blood sugar stores. There's a big simplification going around that sugar causes cancer. So your entire body needs sugar to function. Your brain, your kidney, your liver needs sugar. So of course, cancer is fed by sugar because your whole body is fed by sugar. So some patients will come in having, not eaten and they're doing a lot of fasting because they think that that's going to help their cancer be healed. But that's really just going to break down the whole functioning of your body. Sometimes, again, people over exaggerate that sugar can cause cancer because, of course, if you're having a lot of sugar intake, mainly just simplified sugars, that can lead to obesity and diabetes, which of course are precursors for cancer. But you don't need to be starving yourself throughout cancer therapy. That's not going to help anything. Best, again, just to do small meals throughout the day and keep your blood sugars active so that your body can focus on fighting off the cancer. High protein and fiber intake is really helpful for energy throughout cancer therapy. Complex carbs, being whole grains, brown rice, quinoa, and oats are really helpful for those energy stores. Protein is helpful for your connective tissues, that being lean meats. If you're a vegetarian, eggs, legumes, nuts, and seeds are helpful. Healthy fats, avocado, olive oil, nuts, fatty fish, especially for helping brain function and also for helping if you're having side effects, for example, of skin toxicities or nails, even oral membranes, healthy fats are really, really beneficial. Iron-rich foods. So iron is the protein that helps bind those red blood cell molecules to oxygen. So when your iron levels are low, your body, again, is having to work harder to circulate that oxygen throughout your body. Liver, poultry, seafood, and as far as vegetables, spinach, lentils, tofu are all really helpful for improving iron stores. Magnesium-rich food. Magnesium is a fantastic supplement because it helps energy production and also helps relaxation, which we'll get into later. I really advocate for magnesium supplementation if you're having any trouble sleeping. Magnesium naturally can be found in nuts, seeds, leafy vegetables, and whole grains. And then again, going into the sugars, processed foods are really stripped of a lot of the nutritional value. So when you're going through cancer therapy, especially if you're nauseated, if it's kind of a work to eat, you want to get the most nutrients you can out of food. So eating things that are stripped of nutrients really isn't beneficial to you. So we are going to watch a quick video here.
We need to stop the share and then share again. And then share. And then do that one, yeah. Okay. And then share, customize, optimize the second one? Isn't that allowed? Okay. Oh. Okay.
Maybe.
Hi, I'm Dana Hunnis, a registered dietitian with UCLA Health. Let's talk about a very important topic that sometimes gets a bad rap: Nutrition. Start your day off right with a healthy breakfast. Consider scrambled egg whites or tofu with fruit instead of a bagel or sugar-coated muffin. If you need a snack during the day, consider having Greek yogurt, hummus, or pre-cut veggies and fruit, which will give you a steady energy boost unlike cookies, a chocolate bar, or an energy drink. When you crave something sweet, consider having a piece of fruit instead. It's nature's candy. Whenever possible, eat fresh foods. And for increased benefits, buy locally grown and organic. They're fresher, tastier, and right off the farm, making them even more nutritious. Also, buying fruits and vegetables while in season costs less. Visit local farms, which offer the option to pick your own fruit and or veggies, and make it a fun event for the whole family. Consider joining a community-supported agriculture program, where you can receive a box of in-season produce from your local farm delivered right to your home. If you don't have easy access to fresh food or to keep these foods longer, consider frozen instead of canned. Choose lean meats that have less saturated fat. Vary your protein consumption by eating seafood 2 times a week. According to the United States Department of Agriculture, eating 8 ounces of seafood per week may help reduce the risk of heart disease. Reduce or eliminate your soda intake. Choose water instead. Remember, we eat with our eyes first. Bring some color to your plate to make your meals more interesting. Enjoy dark green vegetables such as broccoli, romaine lettuce, and spinach, as well as bright red and orange foods such as red peppers, pumpkin, sweet potatoes, and juicy tomatoes. Whether staying in or eating out, choose grilled or baked foods, which are lower in saturated fat and calories than fried or breaded foods. Enjoy your food, but reduce portions. Many times, just serving your meal on a smaller plate will help you reduce your portion size. Just making a few conscious choices about what and how you eat is all you need to get started. I'm Dana. Thanks for watching.
Sorry about that, some technical issues. Okay. All right, so. Yes. So that simple video talks about what to eat and drink when we are eating normally. But of course, with a lot of therapies, people are nauseated. You really don't have that natural cue to need to eat. So if you're having trouble keeping down food, the best acronym to go to is called the BRAT diet: bananas, rice, applesauce, and toast. So bananas, easy to digest, they're high in potassium, and it also helps replenish electrolytes. Rice is really helpful for the binding properties on the stomach when you're nauseated. Applesauce contains pectin, which helps to regulate your bowels. And then toast or just white bread, something just bland and starchy. And obviously, you can go off of this as far as if you want pastas and such, but this is a great simple foods that are easy to digest and keep down. Also, nutritional supplements are really, really helpful. I saw some people with their Ensures here. So some patients don't like these because of their medicinal taste, but you can dilute them. Some patients will put them on ice cream and make a little float out of it. However, you can get the extra nutrients down. There are a lot of different flavors and different companies. Ensure, Glucerna is really helpful for diabetic patients. Novasource is great for kidney function. And then there's also Ensure Clear if you don't like that more creamy base. I think Glucerna also has another clear option. And you can even get these at Costco or your pharmacy or on Amazon if you want them in large quantities. A lot of oncology providers also have samples available. So I always recommend to try a sample, see what flavor you like, and then buy it in bulk. But even having 1 or 2 a day is really, really beneficial, not just with getting the caloric intake, but with improving your energy. Hydration. So our body is 70% water, give or take. Everybody here, I'm sure, has been dehydrated in some manner, whether it be in an arid climate, having too much to drink the night before. You know what it feels like when you're dehydrated. So aim to drink at least 8 glasses of water a day, or 64 ounces. It helps patients to have a visual cue sometimes. They have those ginormous jugs that you can bring around that have, the labels for how much you've had throughout the day. That's a little bit cumbersome. My father's a transplant recipient, and he will take 4 of those 16-ounce water bottles and place them out on his counter in every morning so that he has that visual cue. If he gets to lunchtime and he's only had, half of a bottle, that will give him the cue to, okay, go ahead, drink more, because day in and day out, we forget to drink. In herbal teas, water-rich foods, cucumbers, oranges, watermelon, you can throw some fresh fruit in there and make it feel like you're at a spa. Anything like that, that also helps for fluid intake. As far as caffeine and alcohol, that's something, talk to your doctor about, depending on the different treatment. Usually a cup of coffee in the morning, especially if you're prone to getting headaches without having caffeine, that's helpful as long as you're supplementing it with some extra fluid intake. As far as alcohol, again, consult with your doctor. But generally speaking, if your liver functions okay, if you're going to your grandson's graduation and want a glass of wine, we usually say that, that's okay in the setting of your kidney function being okay. You just want to supplement it with some extra hydration. Fluid generally helps to flush out toxins. If we're having fluid loss from vomiting, diarrhea, or having a fever, that helps to replace those fluid stores, helps kidney, liver, heart, and brain function. And it's also really helpful with constipation. Patients always think about fluid loss with having diarrhea, but when you're constipated, especially if you're taking things like Miralax or Senokot to help push your stools through, your body those medications need to pull fluid from your body to help pull it through. If we're dehydrated and we're taking things like Miralax, it's actually going to cause more of like a gastric bloating sensation. So really, really helpful for if you're constipated, to make sure you're staying well hydrated. Supplementation. So this is always a big thing that people want to talk about. Again, the disclaimer to run all of these by your doctor. A lot of these deficiencies can actually be checked with your metabolic panel or added on to regular lab work, because sometimes people push, for example, we see it a lot with vitamin C. People push a lot of vitamin C. If your body already has enough vitamin C in it, it's essentially just really expensive urine. So if you have the deficiencies, yes, it's very helpful for supplementation. But if your tank's already full, no need for extra. And in an ideal setting, we would get all this supplementation through our dietary intake. But of course, that's not always the situation. So going back to iron, again, that really is important for helping circulate oxygen throughout our body. Vitamin B12 helps support energy production and nerve function. You can take a B complex. B12 is also available in injections. And again, you can have your doctor run a simple blood test to check your B12 levels. Magnesium, again, aids in muscle relaxation, sleep, and energy metabolism. Vitamin D, low levels lead to fatigue. Vitamin D is available in sunlight. It actually only takes about 10 minutes of being outside, even on a cloudy day, to get enough vitamin D that our body needs. But vitamin D is also really important if our calcium levels are low. Vitamin D helps the absorption of calcium, so very important. Ginseng, run this by your doctor because there are certain medications out there, specifically some oral therapies that don't interact well with ginseng. But if it's okay by your doctor, it does help boost energy and can relieve stress levels. Oil of oregano has antimicrobial properties and helps with digestive health, as well as elderberry can help with anti-inflammation, zinc and vitamin C, again, with boosting your immune system, because if you're not feeling well, you're going to be more tired. So this is my favorite slide talking about exercise. So the best thing we can do when we're fatigued is to exercise, which just sounds so counterintuitive. You think you're tired, you need to rest, which yes, you do, but keeping up your endurance levels is helpful not only for your mental health, but for, keeping that cardiac health, keeping your pulmonary health, and just making sure that your muscles aren't atrophying. Because especially if you're only on a set schedule for treatment, once you get done all of that, the last thing you want to have to do is build up that muscle mass. Simple things like walking it's just so helpful to even walk 5-10 minutes a day. I tell patients if they have a dog, walk the dog once a day, or if you have a partner, walk around the neighborhood, hold hands. It's really good, again, for circulation, mood, and energy. Seated marches is really helpful. I'm gonna demonstrate just real quick. So, yep. Stop the share. And then I'm going to Sorry, I'm making this complicated. So, go ahead. So simple, just when you're sitting watching television, just doing simple step marching, it seems, ridiculous, but it's really helpful, especially if you're having edema in your legs, to help that circulation. Also, if you're having swelling, to elevate your legs as best as you can, even just grabbing another chair and propping up to, have your body not need to work against gravity. One of the best simple exercises to do to help with your general health is just a simple sit to stand. And I used to tell patients to do this on commercial breaks, but now with streaming services, you never know. But just a few times a day, go keep your legs hip width distance apart and just go simple sitting, standing to sitting, standing to sitting. Do that 5-10 times. Again, it seems so simple, but not only is it really good for your muscle mass, but it's very helpful to prevent against orthostatic symptoms. Orthostasis is when you go from sitting, you stand up and your blood pressure drops, which can cause you to get dizzy. So it's helpful to condition your cardiac rhythm so that when you're going from sitting to standing, your blood pressure isn't dropping. And now it's a really good place to be doing this, because if you do start to get wobbly, if you get lightheaded, you just sit right back down. So whether you're being on your couch or what have you, again, do this. It will benefit in so many ways. A lot of times when people are getting dizzy and having falls, it's especially when they're getting out of bed at nighttime to go to the restroom, and it's because they're having those orthostatic issues. So again, not only for the fatigue benefit, but for pulmonary and cardiac function, this is a great, simple exercise. Another great exercise is to get weights, which I'm glad you guys have these here because I forgot mine, but just simple 1 pound, 5 pound, 3 pound weights. You can get these online. You can get them at the dollar store at Five Below. Or if you don't have them, just use soup cans, are really helpful. And do just a general up, back, down, up, back. You can also do some bicep curls if you want to, but this function here is where we tend to lose a lot of the muscle mass in our arms. Again, If you're watching television, do it on commercial breaks. Simple things, you don't need to start training for a marathon. Simple things can just go a really long way, especially when you're not feeling well, just to make sure that you're keeping that muscle mass and all of your organs functioning as they should.
Sure, thank you. Restart the share. Sorry.
Okay, thank you. Other gentle exercises like Tai Chi and Qigong are really helpful, and they're also very meditative in nature. If you have internet access, YouTube is really great to just utilize for simple introduction to these modalities. I started watching little short YouTube videos during COVID. And I still now, even though I'm back at the gym, we'll do little 10-minute workouts. I have 2 young kids. So, when you get breaks to do these things, and for yoga, it's really nice. I do just discretion if you're doing any inversions with yoga, just limit those if you're feeling dizzy. And, if you did a lot of yoga before cancer, just know your limitations. Chair yoga is also a really great option. And again, there's a plethora of different videos online. And then using those light resistance exercises. Meditation is so helpful. People usually think about meditation that, it takes a lot of time out of your day, but even simple stress and anxiety reducing measures, like if you like to do artwork, reading, music, those also have meditative qualities. If you go to church, have that meditative community to be around. It doesn't need to be, textbook. It can be used in different sources. Can I, for the video, sorry, another quick video.
Sorry.
And a really wonderful breathing exercise that you can do is just simple 5, 5, and 5. There's a lot of other renditions of this, but take a 5-second count to breathe in. 1, 2, 3, 4, 5. Hold it for 5 seconds. 1, 2, 3, 4, 5. And then exhale for 5 seconds. 1, 2, 3, 4, 5. And that's a very proven way of calming you. If you're feeling anxious, that simple breathing exercise does wonders to calm, mind and body. So I will get into prioritizing sleep hygiene. So this is a big one, especially with all that you're going through, not only physically, but emotionally. Listen to your body and rest when you need to, but also try to keep a regular sleep schedule. Please try not to sleep over 10 hours a night. That actually does more harm than good as far as your circadian rhythm. So if you're sleeping 10 hours and you're still feeling fatigued, take a nap, but to sleep over that 10-hour time frame has been proving, to ultimately make you more fatigued. So nap wisely, 20 to 30-minute increments is best, and try not to nap after 4 p.m. because then, again, that can throw off your nighttime sleep cycle. Avoid screens, caffeine, and heavy meals before bed. Ideally, no screens 30 to 60 minutes before bedtime. And that's really important because the blue light of screens can affect your melatonin stores. So that actually makes it harder for your body to get into a REM sleep cycle. And that's with televisions, with phones. They now have glasses that help with blue light suppression. I don't know how effective those are, but it's really helpful to kind of give that break before trying to get into a true REM sleep cycle. Also, if you're somebody that likes to have the television on to have that noise at nighttime, try to switch to some type of phone app, or there's nighttime sleep sound machines that are really helpful. Just again, not to have that stimulus on your eyes before trying to get a good night of sleep. So another big triggering factor of what causes fatigue during cancer therapy is pain. And pain can be anywhere from neuropathies, numbness and tingling, to your hands and feet, mucositis in your oral membranes. And actually mucositis, a lot of times, unfortunately, if you're having it in your mouth, it's going down your entire GI tract all the way to your rectum. Bone pain that a lot of times can be caused from metastasis and also from growth factors like Neupogen, Neulasta. Headaches, muscle aches, and joint pains, also called myalgias and arthralgias, and tumor-related pain. So pain control option, again, a lot of these run by your doctor, but over-the-counter Tylenol and ibuprofen. Ibuprofen is an NSAID, a non-steroidal anti-inflammatory drug. So that can put stress on your kidney and liver function. It also can worsen bleeding. So if your platelet levels are low, your doctor will likely say to minimize ibuprofen and NSAID intake. Prescription pain medications, opioids, obviously you would want to use those in moderation and they need to be prescribed. Gabapentin or pregabalin or Lyrica help with nerve pain. Those are medications that are usually ordered in very low doses, but can very much need to be titrated. So if you're starting on a gabapentin 100 milligrams 3 times a day, that dose can go up. It's very different with how people respond based on different doses. So just follow up with your doctor about dose levels for that. Topical agents, lidocaine. For mucositis, there's a lot of oral lidocaines that you can get, or like magic mouth rinses that can be prescribed. Or you can also try something as simple as 1 cup of warm water with 1 tablespoon of salt and 1 tablespoon of baking soda. That's really helped to neutralize the acidic levels in your mouth. When using oral rinses throughout cancer, avoid using any excuse me. And steroids help to reduce inflammation, especially when there's tumor compression. But steroids, unfortunately, carry other side effects with it. So something we want to do in limited doses. As far as non-medication approaches, hot and cold therapy is really helpful. Again, try not to do on direct skin, use a barrier in between. 20 minutes on, 20 minutes off is really helpful. Massage and acupuncture, run this by your doctor because acupuncture, of course, if your platelet levels are low, the last thing we want is for you to get stuck unnecessarily with needles. Relaxation techniques, as we talked about with, meditation options. Physical therapy, aqua therapy is something that's really helpful, and most insurance companies do cover that. So if you're worried about just the general wear and tear on your body, aqua therapy is a good option. And then as far as cannabinoids, so something to talk to your doctor about, but we are in California, it is legal. THC has the psychoactive properties and can relieve pain and euphoria. And then CBD, it has the non-psychoactive properties and can reduce inflammation without causing that high sensation. Dispensaries these days do have very good, well, generally speaking, have very good employees that if you go to a dispensary, tell them, I would like something to help with my anxiety levels, help with sleep, help stimulate appetite. We recommend to always use edibles because any extra inhaling of any flower can cause more harm than good on your lungs. So edibles, and there's all sorts of options of different types that you can have these days. But again, consult with your doctor. But with the use of any THC or CBD properties, we recommend to start low and go slow. So, and CBD also, there's a lot of creams that are helpful, especially if you're having any localized pain. So our last slide of today is mental health. And unfortunately, your oncologists tend to always focus on the health of your body, but mental health is so, so, so important and really goes a long way with your energy level. The most important thing is to acknowledge your emotions. So often patients, especially when they're first diagnosed, they get this kind of survival instinct. And it's only later that they really start to emotionally process what you're going through and know that it's okay to feel overwhelmed and scared and angry and numb. You need to work through those emotions because to build them up is not going to be good for you. Even if it's something like journaling or talking openly or having therapists or counselors, a lot of institutions do have options for different therapists. We at UCLA, we have the SIMSMAN team that is a nonprofit, and we have psychiatrists, psychologists, social workers, chaplains, and then a plethora of volunteers just to have a third party to speak to about these things. And then, of course, support groups are fantastic because talk to people that are also going through the same thing really, touches on mental health on a different level. That in mind, keep in mind that there's over 200 different types of cancer. So if you are wanting to speak with somebody specific to what you're going through, there are a lot of different online communities specific to the medications you're going through because a lot of different therapies, the side effect profiles are just vastly different. Stay connected, but be selective. Keep in touch with people who uplift you, but limit time with people who are overly negative or dismissive of your experience. That's really important because if you're like me, you're a people pleaser, and anybody that talks to you, you want to engage in that conversation. But if people are being negative, that's the last thing you need right now. Really try to surround yourself with a good community. There's also a lot of different apps out now, such as CaringBridge or My Lifeline, that's helpful to update people so that you're not being flooded with people reaching out to you. And they're doing that out of love, of course, but it can get really overwhelming and exhausting to kind of relive your experience and talk about it again and again. And, you don't want cancer to defy what you're going through right now. You want to be able to, kind of mentally escape from it too. So, group texts and those apps, or if you want to delegate, to your sister, can you just update the family with what I'm going through? Because emotionally, it's just exhausting to constantly be filling people in. And again, it's out of love on their end, but it can be overwhelming. Let yourself receive help. Please, don't try to stay strong all the time. People want to be helping you, and it's really important, even in simple ways. Can you go pick up groceries for me? I have treatment Monday, Wednesday, Friday. Can you drop me off? Or my sister's coming into town. Can you pick them up from the airport? Little things like that go a really long way so that you're not overdoing yourself. And it really helps friends and family to feel, like they're helping you out, even if it's not, if they can't help your nausea, say, or help, your diagnosis. To be able to just ease your plate in some way is really important to do. And stay informed, but not overwhelmed. The internet's a scary place these days, and please make sure that you're looking at information from reputable sources, because you can really go down, bad wormholes pretty easily. And again, there's so many different types of cancer. There's so many different types of treatment. You can have the same cancer as your neighbor, but have completely different cytogenetics or different metastasis profile. And so you're getting completely different treatment, your different side effects. So it's really helpful to kind of hone in on the information you're getting so that you're not overwhelmed with things that really don't apply to you. And try to avoid doom scrolling. Unfortunately, the internet is programmed to try to keep our engagement. And so just try to be mindful of that, and limit your time with being online if you can. So to end, I always recommend for patients to put some sort of motivational quote on their bedside table or in their bathroom, on their mirror, just to constantly try to keep you uplifted. You're going through so much. One option: cancer is only going to be a chapter in your life, not your whole story. Galileo has an amazing quote of, "I have loved the stars too fondly to be fearful of the night." And then there's the serenity prayer: "God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference." Or you can simply, put up pictures of friends and family, or just an inside joke that you have with some friends is just really helpful, just to look at when you're brushing your teeth and remind yourself, that you have life outside of this cancer journey, and to stay strong through it. And that's all I have today. Does anyone have any questions?
Wonderful. Thank you so much, Colleen, for that information. For those online, feel free to please put your questions into the chat, and Colleen can get to them. And then for those in person, you can raise your hands and we'll get to them after the in-person, or the online, I mean. So first question online. Do you have a magnesium supplement to recommend to aid with sleep? I have trouble swallowing pills, so a gummy or liquid is preferred.
There's one called it's L-thyroxine. I want to you're looking it up. That's a specific type of magnesium that's really easy to digest. I don't I can try to look it up.
Okay. The next, yeah, go ahead.
That's really easy to digest. There's also magnesium forms that they say, like similar with iron, that it's a slow magnesium that tends to be easier. I don't know if it's available in any liquid form, but there are also gummy supplements, which tend to be a lot easier for people to swallow. And that's the sort of thing, it's not timed release. So if you need to break up pills, that's okay for magnesium.
I'm not sure if you can answer, but so one of our participants has non-Hodgkin's lymphoma. They're not in treatment yet, but they're always tired. Do you think it could be lymphoma?
Yes, absolutely. So lymphoma is assuming that you have a B type of lymphoma. Our B cells are one of the subsets of our immune system, and B symptoms are common with lymphoma, and that can be anything from fevers, night sweats, chills, extreme fatigue, and unplanned weight loss is a response of those B cells kind of overacting. So that very much can be a side effect. With some types of lymphoma, and again, there's over 70 types of non-Hodgkin's lymphoma, a lot of times therapy can actually help you feel better. Always, going through the treatment is hard, but patients sometimes can be surprised with, especially if you're having a lot of disease burden, how when those lymph nodes shrink, and energy stores and such can improve.
Wonderful. Thank you, Colleen. Yes, go ahead.
I noticed on the hard pills, which is really hard to swallow mentally, and you play in the house, it starts to less funny. I experimented with pudding and with jello. And that liquid mass seems to swallow it easier and goes in without me having to wiggle it.
Perfect.
So maybe-
Yes. Yeah.
So there was a recommendation in person for the comment about having difficulty swallowing, that they tried puddings or jello, and that did help help them swallow. So that could also be an option as well. Are there any questions in person? Well, I just want to thank you, Colleen, for your time and
Thank
such an
you.
informative presentation. Thank you so much for being here with us.
Thank you all for being here.